In the last video, I talked about my acne story. And if you have watched that video, you understand my acne started because of changes in hormone. So in today's video, we're going to talk about hormonal acne. What is hormonal acne? Hormonal acne is an acne that resulted from changes in hormone, which causes excess oil to be secreted. This oil interacts with bacteria in hair follicle, causing acne. And that's why you start hearing clogged pores. When your pores are clogged, it means that oil has covered the pores of your hair follicle, preventing it from breathing. And that's what happens when you use, at times you realize that when you use foundation or something oil on your face, you start having breakouts because your skin cannot breathe. How do I know that this acne is hormonal? Number one, when you experience acne prior to your period, you always have acne before your period, it means the acne is hormonal. When you always have acne during pregnancy, especially early stage of pregnancy, and as the pregnancy progresses, this acne fades or goes away, it means that it's pregnancy acne. When you are having acne by virtue of some medication, maybe you took some antibiotics and steroids or whatever, and at the end, after some medications, you realize you're having acne, that means that it's hormonal, because those drugs changes your hormones, causes hormonal acne. Your period is not regular, you can have acne because your hormone is not balanced. When a lady is entering menopause or already experiencing menopause, there's high tendency of the person having acne. And when a child is growing into an adult, at that puberty stage, there's surge in hormones. These active hormones is going to cause this girl or boy to start having teenage acne. So we know that these are hormonal acne. Now, another thing is that some hormonal acne, some acne can be genetic. So by virtue of your gene, you're predisposed to acne. So that's another acne that can be hormonal because it's from your gene, it's from the blood. Have you ever heard when they tell you that this acne is in the blood? Yes, there's high level of acne being genetic. We're going to talk about that in the next video. What do I do? Now, being hormonal does not mean you relax and say this is hormonal. No, there are some habits you do that will exacerbate this hormonal acne. Now, if your acne is coming because of your period, allow it to come. It will go when your hormone balances, because when there is period, there is change in hormone, there is imbalance in hormone. So when the period goes, your acne, your body will become fine. But when you're popping the hormonal acne, going to exacerbate this acne and infect your face. Just like my face, then your face will be like a German floor, because when you pop one, that one will bring out water and develop another acne, and that one you pop it again, at the end they are forming, you're forming a chain reaction. At the end you end up having a German floor in your face. So whenever the hormonal acne comes, don't touch it, don't pop it. Whenever you're undergoing excess stress, you're going to trigger change in your hormones, and you're going to exacerbate already existing hormonal acne. Whenever you don't sleep well, you're going to increase the cortisol in your system, and it's going to exacerbate the acne. When you don't drink well water, you're going to be dehydrated, which is going to exacerbate the acne. When you eat over processed food, you're always snacking, you're always taking soft drink, you're always taking ice cream and yogurt, all those over processed food is your food. Some people, when you ask them, when did you take fruit last, they say, I can't remember. So when you're feeding your system with all those over processed food, you're going to exacerbate the existing hormonal acne. Remember, this hormonal acne cannot be helped because its hormone is come naturally, but it can also look for a means of managing it and keeping this acne at bay by this lifestyle: sleeping well, managing your stress, not touching the acne, eating well, and making sure that you're very hydrated. In the next video, we're going to talk about how to manage this acne, and I'm going to tell you the message I got from my own mess.